Hi, this is Dr. Bhargava. In this short video, I have several interesting cases to share with you. This is our first patient. They presented for an FDG PET-CT scan of the brain to localize seizure focus in an interictal phase. We will start by looking at the rotating image. And on this rotating image, we find very unusual pattern of FDG uptake. There is uptake seen in the right cortex and there is barely any uptake seen in the left cortex. The left cerebellum looks okay, but the right cerebellum looks hypometabolic. On the right, we have the fused PET-CT images on the same patient showing thin atrophic cortex on the left side, seen here and here, with severe hypometabolism, and all of this hypodensity, which is ametabolic, suggesting encephalomalacia and gliosis, which are better seen on their follow-up MRI, where we see this encephalomalacia and gliosis and the atrophic cortex seen right there and right here. And so the cerebellum on the right side is hypometabolic due to a phenomenon called crossed cerebellar diaschisis. Anytime there is an abnormality in the cortex on one side, the other side cerebellum shows hypometabolism. That is what is crossed cerebellar diaschisis. This is a reference article on the same topic, the role of SPECT and PET in epilepsy. This is our next patient, and we have performed a PSMA PET-CT in this patient who was recently diagnosed with prostate cancer. Let's start by looking at the rotating image. We find physiologic distribution in the lacrimals, the salivary glands, and then we see this heterogeneous large focus in the prostate that is sitting below the urinary bladder activity, and then a focus in the region of the left shoulder. And so this is the cross-sectional images are showing urinary bladder activity, then the primary in the enlarged prostate, multifocal uptake, and the focus in the left humerus is seen right here. It corresponds to a focus of osteoblastic activity or sclerosis and is consistent with osteoblastic metastatic disease. This is a rare example of solitary bone metastases to the left humerus in a patient with a prostate cancer. These images right here show a large left-sided inguinal hernia containing a loop of bowel and some mesenteric fat. So the patient comes back after treatment, and this is a follow-up PSMA PET-CT. So we are looking at the rotating image. We find that the focus in the prostate looks better. It is smaller and less intense. And here we get a sense of this very large inguinal hernia also, right there, which is seen over here as well on the cross-sectional image. The humeral metastatic disease has healed. We see sclerosis and no PSMA uptake on this follow-up scan. So again, a rare case of solitary humeral metastasis in a patient with prostate cancer. This is a good article on the topic of role of PSMA PET-CT in distinguishing malignant from benign solitary bone lesions in prostate cancer patients. This is our next patient. We performed a whole body bone scan to look for metastatic disease, and we see a unique pattern of uptake on these anterior and posterior whole body images. There is symmetric uptake in the craniofacial bones, best seen on this anterior image, and to some extent seen on this posterior image as well. There is another focus of uptake in the mid-thoracic spine. They probably belong to the same etiology, which is multifocal or polyostotic fibrous dysplasia. This focus looks like an eye mask sign, or as one of my colleagues would like to put it, the Zorro sign, from fibrous dysplasia. This case was shared by Dr. Andrea Marques from Lisbon, Portugal. Here is a graphic showing how this corresponds to an eye mask sign, and it can also be called the Zorro sign. And here is a reference article on the topic, eye mask sign and fibrous dysplasia, on MDP skeletal scintigraphy and SPECT-CT. Thank you for watching.